customs, and rituals, and know the concerns of Orthodox and Hasidic women, which can reduce their levels of stress. This is the very reason why Hatzalah was formed to serve the Jewish community years ago, and the very same reasoning applies here. Members of Ezras previously tried to address Hatzalah's prohibition on women EMTs as members, but they were unsuccessful in changing the organization's policies. Some organizations opposing Ezras Nashim's application cite concerns of competition or alleged confusion by an addition of another ambulance service, but we respectfully submit that such claims lack credibility on their face. Ezras Nashim is seeking approval to operate a single BLS ambulance in a 2-square-mile area and only for calls made directly to it. These calls will come from observant Jewish women who are already calling Ezras Nashim for their first responder services, and from observant Jewish women callers who currently avoid calling for ambulances due to the modesty concerns described before. Furthermore, when Ezras Nashim currently responds to calls that require an ambulance, they contact 911, which results in FDNY responding. FDNY has not objected to Ezras Nashim's application, and granting this application would in no way harm FDNY. In fact, the number of calls that Ezras Nashim would respond to would be negligible compared to the number of calls that FDNY addresses each year. Ezras Nashim having the ability to transport patients would actually benefit FDNY by reducing its workload, albeit to a very small degree. Allowing FDNY to attend others in need by giving us our ambulance. We thank FDNY for its support. Thank you very much.
Ezras Nashim has received significant community support in connection with this ambulance application. While the issue here should be appropriate services from a public health perspective, Ezras Nashim has received significant rabbinical support. This includes a letter of support from Rabbi Eli Vogel, head of the Academy of Zecher Moshe Yeshiva. His letter provides, among other things, in his letter, I fully endorse the chesed, the compassion, mission of Ezras Nashim, namely, women helping women. In this way, women will not compromise their tznius, modesty, in an emergency situation. Rabbi Yaakov Moshe Hillel, head of the Academy of Yeshiva Havat Shalom, concurred and affixed his stamp and signature to Rabbi Vogel's letter of support. Rabbi Moshe Brandstorfer, the Grand Rabbi of the Congregation Heichal Hora, did the same. By this, Ezras Nashim has the endorsement of leading rabbis and scholars of the generation located in Israel. As an analogy, the U.S. courts have a hierarchy, with the lower courts located locally, and the highest level, the U.S. Supreme Court, located in Washington. Similarly, the rabbis who have endorsed Ezras Nashim are at the highest level in the hierarchy of rabbis. Ezras Nashim has support from many additional rabbis and others as well. An online petition has over 2,000 signatures of support. Brooklyn Borough President, members of the New York State Assembly, members of the New York City Council, chairperson of the Brooklyn Community Board 15, healthcare providers, and many others, the publisher and the managing editor of the Jewish Press. The Orthodox Hasidic women of Borough Park have a clear and specific need. We respectfully submit that our need, which has been suppressed for so long, is undeniable, and the time has come to fill that need. We appreciate your consideration, and we have brought some other people to talk tonight in regard to this need. Thank you very much.
What I'd like to say thank you to Ms. Levine, Ms. Pomerantz, and Ms. Fry for presenting here tonight. Mr. Reisner, do you have questions, anything that you'd like to raise?
I do have a few.
Okay.
Wanted to add some points, Mrs. Fry?
Mrs. Fry, I'm sorry. So I apologize, Ms. Fry.
Okay, my name is Miriam Fry, and mostly, can you hear me? Better?
Better, thank you.
I am an EMT for almost 35 years, and the origin of my EMT license was actually to join with Hatzalah in a special field not specifically for general calls, but specifically really for childbirth and related kind of situations where a woman would actually prefer a woman. I love Hatzalah. I think they're great, have a special place, but I think there's a special place for a woman, where a woman needs a woman. I'm a mother of 12 children. I've had 12 childbirths with male obstetricians. I do not have a problem with that. This is not a religious problem. It's just the way I feel as a woman. I've been a doula, volunteer in my Maimonides for the past 20 years, and I feel that a woman needs a woman near her in times of stress, especially during stressful times like the childbirth, and sometimes related issues. And as a woman myself, if I ever had to give birth, and believe me, some of my births went very quickly, I would never, as much as I like Hatzalah, I just could not. I said to my husband, I will never. Do not call them. I cannot tolerate that exposure. I'll do it myself. But maybe it was silly, but that was my trauma. And thank God I always made it in time to the hospital with my husband racing, or with the taxi, or whatever it was. Thank God for that. But I'm a proud mother of 12 children, grandmother, and a great-grandmother by now. And I think I have a special calling as a woman to help other women. As an EMT, as a volunteer, I've been in situations where some of them were not really childbirth. A woman got a burn on her breast, and she called us. She didn't want to expose herself. Now, I don't think this is a religious issue. I just feel, as a woman, it's just an inborn nature for her to feel more comfortable with another woman. And we handled her. She was very happy with our care. I am also working as an EMT for all these many years with in a girls' camp for 30 years as an EMT. So I've been in many different situations, and I've even handled the male staff. And they had no problem with it. So this is not a religious issue. I handled a man with a cardiac arrest, almost, I would say a heart attack, really. And it wasn't a religious issue. It's just, I think they would have felt more comfortable with the men, but I've seen that even with going on calls with Fidney, when I was going as a ride-along. I realized that there was a male EMT and a female EMT. They knew their place. It was not a religious issue. It was just if there was a female patient waiting for help, it was the female EMT who did the actual checking, the personal checking, taking her vitals, and the male would be taking the notes and doing all the recording. And it was the opposite way. If it was a male patient, the male knew it was his job to do the vitals, and the female would do the recording. So I just feel this is a very special place. We also had a woman we attended to, who her husband had called for us because his wife, who's mentally ill, was fooling around with medications. She would not take her medications properly. He was afraid for his life. She had taken out a knife, so he called us. But when we got there, this woman was in her bed, under her covers, but she was stark naked. Then we knew why we called, why they wanted us to be there. We had to help her get dressed, convince her to come to the hospital with us. But the main thing is really, we've had really great backup with the fire department, and they've been really good with us. But some women, or in some situations, there are many, especially in childbirth situations, it was a woman that really would have felt more comfortable with us doing the transport along with it. Thank you.
Thank you, Mrs. Fry. If you could just remain in the area and be available for questions, Mr. Reiser, I think you indicated you want some questions.
Thank you. And I'm sorry, ma'am, I didn't get your name.
Miriam Spride, S-P-R-E-I.
Spride?
Spride.
Okay. And
That's the last name. Miriam?
Miriam Spride, thank you. And could I ask you just a couple of questions? You mentioned that you've given birth to 12 children. Is that
Yes.
correct? Congratulations.
Yes.
That's a wonderful thing.
Yes.
And all of them are healthy, I suspect?
Yes.
Wonderful. I'm happy to hear that. And in giving birth to those children, you birthed with male physicians,
Right.
right? And you didn't take issue with that.
No.
Yet you, through Ezras Nashim, are asserting that there's a distinction between birthing with a male physician and a male emergency medical technician, correct?
Exactly.
Okay.
Only because a household member might be my neighbor, might be somebody that knows me in a different way, it may be a relative, and I just did not feel comfortable. When I went to the doctor's office, I had an interview with the doctor, and I felt comfortable.
So
In fact, this is an emergency situation where I just got traumatized by the fact that, hey, who is this guy?
it's an emergency, right?
Yes,
And
exactly.
therefore,
And that caused a lot more stress.
it's an inherently stressful situation.
Inherently,
Correct.
right.
And
And I definitely do not want a male, and did not want to be exposed to a male.
but
Yes.
the nature of the emergency is such that quick action must be taken. Would you agree with that?
In the childbirth situation, I did not feel the need that there was a danger. I did not feel that I was in a true danger.
And you didn't need
I was
you
just
didn't need an EMT in that
traumatized.
situation. It sounds like, is that right?
Don't know if I didn't need, I needed someone to hold my hand. Even in the childbirth situations in the hospitals years ago, where they did not allow anybody else in the room really, even the husband, I felt, that's why I became a doula. I felt that I needed another woman near me to support me.
Sure. But you said that this is not a religious issue, correct?
No,
It's not a religious.
no, I just feel it's innate in a woman's nature.
It's not a religious issue of need.
I don't think it's specifically a religious issue.
Okay, thank you.
No,
And wouldn't it be fair to say that
it is cultural because it's not a religious issue about having a male doctor. Exactly.
okay.
I just was traumatized by the fact that I may have a member of our community who might be somebody that I did not really want to face up with.
But it might not be as well, correct?
Maybe.
Hatzala
but I
has
was-
over 1,000 members, isn't that right?
Yeah, but they are still community members.
Sure. Now, and you had joined Hatzala at one point, or considered, or
Well,
applied?
We were hoping that Hatzalah would integrate us. We are not really here to compete with Hatzalah. I don't think this is a competition. I think this is a compliment because I feel that a woman has a special, there are women that would prefer to have a woman there, and there are special needs that a woman has in certain situations where a woman, even though Hatzalah is great, I think where a woman would be more preferable.
But you specifically had explored joining Hatzala at some time in the past, I think is what you led with when you started
Well, when
speaking,
I
is that
say,
right?
yeah, an emergency, yes, as an emergency, yes, I would
And
have.
that experience left you with a bad taste in your mouth, it sounds like.
No, I just don't know why it never happened. I was never into politics. I'm not sure why it never evolved, but a few years ago, when Mrs. Rocky Fryer decided that she would go on with it, I was very excited.
Wouldn't it be fair to say that your disdain for Hatzala has something to do with the fact that you were not able to, your involvement with them was not able to evolve in the way that you'd hoped that it would?
Can you repeat the question?
Wouldn't it be fair to say that your disdain for Hatzala has evolved somewhat
I have
due to
no
your...
distaste for Hatzalah. I just feel that a woman has a special place in dealing in emergencies in certain situations. And it really would be ideal if we could work together, but I don't think that's my choice
Okay.
at this point.
But it's not a religious issue as to need, correct?
No, to me, it's not a religious issue, not
Thank you.
at all.
And ma'am, your name?
I'm Celia Pomerantz.
Celia Pomerantz, thank you. And Ms. Pomerantz, you were speaking about the one ambulance slide on page 3 of the PowerPoint, correct? And can you tell me how many people live in Borough Park?
We know that the population is increasing in Borough Park by leaps and bounds. Highest birth rate, Maimonides Hospital, 12,000 births, I believe, a year.
Right. There's a lot of people,
A
right?
lot of people in Borough Park.
Over 100,000, I think,
Correct.
right? And it stands to reason that there could be circumstances where more than one emergency could come in to Ezras Nashim at a time. Is that fair to say?
Yes, I actually had that as a dispatcher. I was dispatching one night. We had one call, and within 5 minutes, we had another call. But yet, we had an EMT to respond to each location and they both ended up very happy and safe. And I couldn't believe that. Wow, we had a double call. Some days we have, a few calls, some days less, some days more. This is a specific need of a specific segment of Borough Park. It's not to say that everyone at Borough Park is going to be calling, but those that
Sure.
want us, we have this service that was never around.
And you advertise so that people know to call you, right?
Well, I mean, it's pretty new.
All right, you have vehicles that have your phone number on them.
Right.
There are flyers and Facebook pages and media coverage and all sorts of things, correct?
Yes.
So people know that. So you get the word out so that they can call you. Fair to say?
Yeah, I mean, if
Sure.
they were in an emergency and they didn't know, they only wanted a lady, they didn't know the number, I don't know what may have happened. A lot of these women may just not want to call and say, I'd rather, whatever has to happen, happen, and that's very unfortunate.
You hope more call, I would say. Is that
Sorry?
fair? You hope that more call eventually over time,
Well,
right?
it's about the need of whoever wants us, we're here for them. Whether it's, I don't know the numbers, but whatever number it is, at least we saved that person's life.
Mhm.
At least we helped that person in a dignified manner.
And going back to the time when you had 2 calls, how did you handle both of those as far as your interface with transport?
Well, we had our radios, so we had EMTs responding to both, and myself as the dispatcher was in touch with the FDNY system.
And what was the response time before FDNY was on scene with an ambulance?
I'd have to check. I don't, this was going back 3 years ago. I'd have to check on the actual response time. I'd have to look at the call log, because we actually logged the time that the member got there, the time the ambulance got there, so we could check back on that.
Was it under 2 minutes?
I don't remember.
Have you ever seen a circumstance where you were able to put an EMT on scene and then call 911, I believe you said is how you operate, right?
Correct.
And call 911 and have FDNY on scene in less than 2 minutes?
I don't know if the FDNY got there before the member, but at least our member was able to get there, stay with the patient, stabilize the patient. They are certified EMTs, so being able to keep the patient safe, whether it's giving oxygen, controlling bleeding, and when the ambulance gets there, they work together, get that transport, which makes that need even more, because if we would have our own ambulance, they will have that radio. We would have someone on shift for that ambulance. That's going right away. I wouldn't even have to make that second call to FDNY. It would be a call put out, members going, ambulance is going, done. We saved a few minutes here.
For one patient.
Correct.
But what about the other patient who's calling at the same time?
We would still have a member going and stabilizing that patient, doing whatever they would have to do in the emergency. And we do have FDNY as our backup. They're mutual aid with us, and they still will consider to back us up in the event that we have a double emergency and we have our ambulance heading out to emergency number 1, and then as mutual aid, the dispatcher would call and say, the same way we do it now. So, we have to start, we're starting out slowly. We're not going and aiming at, multiple ambulances at one time. We're a new organization, and we're taking small steps at a time.
When you call FDNY, do they respond with an orthodox woman EMT?
They don't, I don't, there could be Orthodox, I don't know if they do, but many times there is a female EMT. In the event that it's not, the male EMTs have been very respectful. They say, you can do your part, and, we have a mutual respect here. We give over the vitals, we're talking to them, we're telling them what's happening. They're just not involved in the actual patient care on hand. They're not, whatever it is, if we need that backup, they're doing our transport.
Right, but there's no guarantee that you're going to get even a female EMT, much less a female orthodox EMT when you call FDNY, correct?
Correct. So
Thank you.
our team would be Orthodox, understanding the cultural norms, understanding the traditions, and that's what makes our community, those in the community who want us, who need us, that's what makes them more comfortable. We will understand that, they would understand that portion of that need. It kind of goes together with the general need of what this population wants.
But when you face a situation where you've got 2 calls at once, you cannot, with one ambulance, service both of those calls. And therefore, you cannot meet the need in the way that you are portraying yourself to be able to meet the need in the application,
So, to be honest
correct?
with you, this happened one time, 3 years ago, and it was about a 5 to 6 minute gap of time. But again, we would fall back on that mutual aid with FDNY, who's been backing us up all this time, over 5 years.
5 to 6 minutes.
No, when I was saying 5 to 6 minutes was the difference between the two calls. One call, 6 minutes later, another call. But when I completed a call is completed on our dispatch system when either the patient goes to the hospital or RMAs. So when I say call, the help was already there by the time the second call came in. It just, when I say call, it wasn't completed because we were still getting the patient ready for transport. And I tell the dispatchers when I train them, the only time you close out a call is one of two things. It's either transported or RMA. So the 5 to 6 minutes was the time frame between the two calls. I don't believe it had nothing to do with the response time.
All right, your response time is 8 minutes, give or take, correct? On average?
I would have to check that.
That's what the application says.
Okay.
And that's before you can put BLS on the scene.
That's
Correct?
that.
You're not an ALS agency.
Not yet.
Right.
Not ALS.
And then you run into an additional amount of time to get ALS on the scene once you arrive, assess the scene, and then have to call 50, correct?
We would ask for that help, yes.
Thank you.
Thank you very much, Mr. Reiser. I'm going to have I'm fortunate, I get to ask some questions, and please, I want to say thank you, and I want to apologize for the ignorance I'm going to show. One of my questions is, does Ezras Nashim have Shaver Hatzalah as a mutual aid partner? Am I saying it wrong? Does Ezras Nashim use Shaver Hatzalah as a mutual aid partner? Could you comment why you don't? If there is a reason. Have you considered it?
I'm not sure what ended up happening, but I'm sure my mother reached out to Hatzalah and they didn't want to have anything to do with it.
Okay, I thank for whatever energy is in the room. I'm going to ask the ladies that are here, and if there are other people that are from the community would like to participate, I promise you will have an opportunity. So there is no agreement or understanding.
No, they don't want to work with us.
Okay. And again, this is I'm coming from a place of respect, but a place of lack of information. In the presentation, there's a note, I think it's under the public need. One of the first bullet points is Jewish law prohibits Orthodox Jewish men from touching unrelated women. The second bullet point says there is an exception for life-threatening emergencies when no qualified woman is available. We who are EMTs have often been on calls where there's an emergency, but not necessarily a life-threatening emergency. Is there any distinction that's being made when there's a there's a broken arm, there's, I think you mentioned a burn, there's something which is not life-threatening, but it's an urgent matter that needs attention. Is that something that is addressable by males when it's a non-life-threatening situation, or is this something that your community finds is very much objectionable? If you could speak to the microphone, because I didn't hear your response, and I don't think that we heard you.
The people that call us, they make that initial choice of calling us. Whether we have what I call sometimes checkout situations. It's an elderly woman, she didn't remember, did I take my blood pressure medication, did I not? It's not typically an emergency. Maybe when we get there, it might be, she might be, 250 over 100. Yes, that's a big emergency. So as soon as our EMT would assess that, then yes, it becomes life-threatening. But many times we get calls, some people downplay it, some people make it more than it is, but we don't know. Dispatcher on one end, we just have to respond, we have to respond to each call. So we don't always know right at the time, life-threatening or not. Well, life-threatening we do know, but we don't always know when the non-life-threatening turns to life-threatening. So we definitely, and they make that first choice to call us.
Thank you. And one more question. As women, why don't you join Hatzalah? And again, I don't know the answer, so I apologize if I told the joke. I'll be glad to tell you another one, but I don't know the answer. Why don't you join Hatzalah?
That's what we wanted to do for a number of years. That's what we were trying, but Hatzalah doesn't allow females to join.
Wait, you're saying females are not allowed to
They're
join?
not allowed to join Hatzalah. They want it to be only men in their agency.
Okay, so if Hatzalah, so Hatzalah does not have any females that are on the response crews?
That was the thing that we wanted. That was like, the best option, but they, after, time and time again, asking, they always rejected us.
This was an idea many years ago. This was, like we said, it was a
Okay.
need that was suppressed for so many years.
I'm not sure, to be quite honest with you, the question was in the back of my mind. It's one of those implicit things, and maybe sometimes it's so. I think it's important that you mention, like, okay, so if you've got Hatzalah, and if you have a response from within the Jewish community, the existing Jewish community cannot provide a first responder who is female. Am I accurate, or am I inaccurate?
That's-
Other than your
So
organization.
my mother actually did go, a few years ago when she was starting, to the rabbis, and they did tell her, and I remember that happening, that Hatzalah doesn't feel it's going to be appropriate to have males and females together working in the same EMS agency. They feel like, it could lead to inappropriate things. So the rabbis told us, open up on your own. They felt that would be the best way to keep, to get the women the help that they need, and to make sure we don't get into any inappropriate situations.
Okay, and I appreciate Ms. Levine. I'm not asking you to speak on behalf of Hatzalah, and again, we're not using, rules of hearsay and evidence like that. So I'm not going to ask, whether that is true or not true. But my concern is, and I hope that someone will correct if I'm misunderstanding, that if a female said, "Hey, I'm an EMT, I'm a doula, I'm an RN, I'm this. I'd like to be part of a first response team. Where do I sign up, Hatzalah?"
They would
You
say
say thank you, but we wouldn't be able to use the services.
Yeah.
Okay. And I'm going to say the following. I teach in East Williamsburg, and I have wonderful people in the community, Hasidic people in the community. I see Hatzalah fly cars. I know how fast they respond. I know that the response time is very fast. And I'm going to raise a question, because Mr. Reisner already did, and I think he made his point very well. He's talking about, Hatzalah has and is very well known for their response time, and they are there, and they're as my grandfather would say, Johnny on the spot. Would you say that response time should be discounted, or is the other factors of being present as a female to another female even more overriding?
Yeah, in many situations, having that secondary trauma could be overriding the 3-minute response time.
At all.
Yeah, there's so many different situations where the extra 2 minutes doesn't make a difference, and it makes more of a difference to have a female, someone who's going to, keep the patient calm and, do the right thing for the patient.
Okay.
We can't, we do have an unbelievably fast response time.
I thank you. I'm going to hold questions because I love to ask questions, but I'm not going to. I'm going to ask the AMIS committee to ask any questions they'd like to share. Dr. Schenker, would you like to head in? Okay.